40,000 people in America declare bankruptcy every month due to medical expenses. America spends more money on healthcare than any other country in the world, yet Americans consistently experience worse outcomes than people in other developed nations. Today we're visiting a clinic that exists for the people who fall through the gap. So here are my questions. Why does getting sick in America still feel like a financial risk? If America spends the most on healthcare, why can't people access it?
When the government got involved in healthcare, like when we started having Medicare and Medicaid, I understand why we did that, and there was a need, right, for people to have access. And it's still this is a really polarizing conversation that people have very strong and high opinions about.
Yeah.
Like socialized medicine, do we let the government practice medicine, or do we keep it on the ground, right? And there are great arguments for both, but there's no doubt that is when healthcare started to get really expensive. And right now there's a lot of negotiations that happen between the payer, the insurance company, and the entity, the organization. And when you are setting up your billing, you go and you negotiate what rate will be paid for particular services. Well, when we saw Medicare and Medicaid come around, the government said, I imagine they felt like they were advocating for the people, that couldn't afford it.
Yeah, it was good intentions.
And good intentions, right? And so they were like, well, I understand that this is the rate, but we're only going to pay 50% of that. And which may have been below cost for the hospitals, right? And so hospitals or healthcare organizations were like, well, we can't afford for you to do that, and us have a lot of patients that you're only paying 50% of what the bill rate was. So in order to make up for that, we're going to have to increase the billed rate for private insurance and for Medicare and Medicaid, right? So that you can make up for what you're losing through the billed Medicare and Medicaid patients. And that's why you see so many doctors that won't take Medicare and Medicaid anymore, or they'll cap the number of Medicare patients that they will take. So I think that greed, and in combination with the pharmaceutical companies, has just allowed healthcare to become this money-generating machine. And
Morning.
Good morning.
Busy day?
This morning was pretty busy, yes.
It looks busy. How many people do you guys serve a month?
From 600 to 700.
A month? 600 to 700 people a month. Wow. So the pharmacy you see here, they're able to provide pharmaceuticals at a reduced cost. I don't know how, but we're gonna find out. This, as you see right here, is the pharmacy. Dr. Kefa, how many years have you been a pharmacist?
Oh my goodness, that's a bad question.
Why?
But it's a good one. Since 2011. So that is how many years? 15 years, right?
Wow, and how many years here with Christ Clinic?
Christ Clinic, this is my third year. I finished 3 years.
Wow, and how's it been so far?
It's been amazing.
How do you like your pharmacy here?
The pharmacy is good, of course, very busy. We expected it to be busy. It's busier than we thought.
Wow.
And that comes with a lot of work. Wow. Tears, pains, and joy at the same time. It's good.
What's the drug that most people get here?
The drug that the most people get, what I can say possibly, we have all the fast movers medication. One of the medications that we are so proud of are the insulins. Like, as you can see here, we have insulins, like, for instance, the
Can you take one out?
Yes, I can take one out. This one is called Basagla. It's a long-acting insulin. And we have also short-acting insulins like Humalog. That's another medication. Humalog.
Is this a popular brand?
Popular medication.
So this right here is your most popular medication. What is this medication?
Okay, we won't say it's most popular. It's so much needed because most of the people, they have diabetes. These are diabetic medication.
This is the thing that's been in the news for so long with insulin.
Yeah, sure. Insulin traditionally has been very, very expensive. For instance, a long-acting insulin like this is called Basagla. We have another one called Lantus. It used to go for roughly, without insurance, way over $250
really?
Per box. Like
and how long does this last?
And that one depends on how much the patient is using.
Okay.
But basically, this box over here, we do not sell. These are charitable medications. Our patients donate some money when they come in, but we do not sell this medication. Patients get it for free.
Wow.
Yeah.
So there's a fee
there is a fee that they pay, admin fee, based on some medications that we have, or the low-cost medications that we dispense, commercial medications. But otherwise, most of the medications like this, they are charitable, they are zero cost, but sometimes patients, they do pay some administration fee for other medications.
So tell me about this pharmacy. What makes it different from another pharmacy?
Being a charitable pharmacy, we operate on something we call sliding scale.
Sliding scale.
Sliding scale. So if a patient, let's say, is below the federal limit of poverty limit or poverty guidelines, then those patients qualify in the clinic to pay $25. As soon as they qualify to pay $25 as total care patient, because they qualify under the federal poverty guidelines, then automatically they qualify for our medications for charity. And in that case, we have two categories of medication. We have charitable medications like these ones, which the patient doesn't pay the value of the medication.
Okay.
But at the same time, we have, like, if you look at this other side, we have other medications, like, for instance, you come this way, all the medications in this category, which are commercial. Now, the difference is, commercial medications, the patients will pay, but they will not pay the market price. They pay a lower cost price. For instance, just to give you an example, a medication like simvastatin, which is for cholesterol, possibly outside in regular pharmacy, without insurance, the patient may pay possibly $20. Over here, they will pay $9 for 3 months. Now, we have other category of patients who cannot afford. So if a patient comes and says, hey, I don't have $9, we just give the medication for free, regardless of how much the medication is, whether it's commercial or charitable. If a patient comes today and says, I don't have medication, I don't have money, they pay nothing.
Wow. And how many people do you guys see here at the pharmacy on a weekly basis?
That's a good question. Roughly in a week, let's say in a day, we see about 70 to 100 patients.
Wow.
So multiply that by 5. 70 times what? By 5? 7 by 5, 350 to 500 patients.
Wow.
Exactly.
That's a lot.
You know, most of the people who come here, if Christ Clinic didn't exist, they wouldn't have a doctor to go see. You know, it's like it's an affordable service that a lot of people need. And, you know, it just gives people, it adds years to their lives, basically, getting healthcare that they wouldn't otherwise get. And I think there's just like a really good atmosphere in here because of it, because all the staff and the volunteers really care about what they're doing, and all the patients, you know, are very appreciative and, you know, happy to be seen.
Yeah. And that's, you know, we talk about like we invest the most in our healthcare system, but we get the worst results.
Yeah.
It's very, very interesting.
It is, yeah.
Is there any stories that have stuck out to you, like particularly, you know, seeing people here?
Yeah, there was one woman a couple years ago, and I'm going to be very light on the details, but she came in just concerned about like some symptoms on the skin on her fingers, and by the end of the appointment, some tests were ordered, and it turned out she had a rare autoimmune disease that I think the nurse practitioner I was with had never even seen before in person. So it really stuck out to me, you know, this woman could have very easily fallen through the cracks and just wondered why she was feeling worse and worse over time. But, you know, someone was able to figure out what was going on with her and, you know, get her the help she needed. Just reminded me that there's, you know, important work being done here.
Yeah. Is it always this busy?
Oh, it gets much busier than this, yeah.
Wow.
But we really try to, just like when somebody that has insurance goes to the doctor and they have an expectation to not sit there forever, we try to hold ourselves to the same standard. So our goal is an hour to get our patients in and out the door. You know, if you're an hourly worker, that makes a big difference, you know, because it's not just costing you for whatever you have to get, it's costing you for the hour of missed work.
Yeah. Very cool.
And, you know, frequently when people come see us, they're in some of the worst situations that they've ever been in their lives. And we have a building full of people that believe God has gifted them with the ability to do healthcare and given them the gift of healing. And even, you know, when you're using modern medicine, that doesn't mean that it's not a gift that God gave you. So we have all these people that have been gifted with this discipline of medicine, and it gives us the ability to just like really love on people and meet them when they're in their most vulnerable point and meet some basic needs and be able to say like, we did this because Jesus first loved us and now we love you.
But you don't have to be a Christian.
No, you don't.
You don't
yeah.
have to.
Preferably, not all of our patients are Christian, because then who would we be reaching?
Right. So true.
It's like everything that you do, you should have a primary goal that you're focused on, and then all of your actions should lead towards that primary goal. And I think that most of the hospitals that started like we have started, and us, right, start with this goal of ministry. And they want to do good healthcare and high quality healthcare, but then somewhere along the way, there becomes these competing priorities. And so I have seen a vision where we grow really big, like a hospital, right? But without ever realigning our priorities, keeping our priorities on glorifying God and saving not just people's lives, but their souls, and letting them just feel the love of Jesus, right? Like, we should say it, but they should also feel it.
Yeah.
And frequently I have people get one or the other. Either they just feel it and no one says it, or people just say it and they don't feel it. So creating a place where people can feel it and hear it, I think, is really important.
Yeah, that's great. I love that. How many rooms do you guys have here?
Down this wall, we have 12. We have another space over there that has another exam room. And then we're about to, this year, we have a couple of build outs planned that are going to add some more exam rooms. We're going to be bringing in dental. So we need a couple of rooms for dental. And then we're working towards building out some surgical suites, which just sounds crazy to even say out loud, but it's definitely something we weren't seeking it out. God just put it in front of us. And we've had multiple people come to us that didn't even know us and say, this is my specialty and I want to help in this area. And so we're just being obedient
And this
saying
is just
yes.
people donating, volunteering.
Yeah. Donating and volunteering.
It's so amazing what you can do just of generosity.
Oh yeah.
Man, if you think about the funding, that it's hard because some people, they take the money and they, like, from the government, and that's what triggers that.
Yeah.
The greed, you start a little
That's right.
small. Yeah. Like
That's
you said,
right.
like they started like good,
Yeah.
It's like, hey, you could do this and you can make a little, extra. Make sure you.
Yeah. There's a difference in feeling, right? Like if I go volunteer somewhere or I give money to a place, that feels different than me paying my taxes and the government giving money to an entity, right?
Yeah.
It feels different for the giver, and it feels different for the receiver, right? Because then for the receiver, it can feel like an entitlement or a right, or they're just super thankful to the government. Versus if it's a place like this where you're like standing face to face with the people that are donating their time and donating their money and making sacrifices to make this place possible, like it's really humbling, and you feel loved, you know. And then the hope is that they thank Jesus, God, for saving them instead of the government.
You think about what happens here and how it affects a town. I just feel like if we could start serving people like this, I believe it could change a lot of people's lives, and it already is. If you want to help serve here, volunteer here, or know more about what they're doing, be sure to follow along, go on their website. And we want to share more stories like this, going out to different parts of the medical industry and talk to different people and hear their voices and shed some more light on this underbelly and educate people more and hopefully encourage and inspire and educate. So stay tuned.